with you. Restylane Classic is also my product of choice for the tear trough.
I think the audience is eager to see some actions. It will be great to see some of the injection techniques that you use to treat the tear trough.
I'm happy to show you my techniques. Tear trough deformity, my injection techniques. I usually make my injections with the patient seated, as a tear trough deformity is better visualized in this position. I would then ask the patient to look up to give a better view of the tear trough deformity. I then begin to make markings of the lid cheek margin. I now proceed to palpate for the borders of the infraorbital rim. After palpating, I would proceed to draw a line to demarcate the position of the orbital retaining ligaments. Using a cannula, I usually anesthetize the puncture wound with lidocaine. After removing my pilot needle, I then proceed to insert my cannula, gently advancing my cannula below the layer of the orbicularis oculi muscle and as close to the supraperiosteal plane, and as soon as the tip reaches the most medial portion of the tear trough, I would slowly inject 0.2 to 0.3 of the filler. My product of choice is Restylane Classic. In a retrograde manner, I would make deposits of small aliquots of the product along the tear trough deformity. I then proceed to inject 0.1 to 0.2 ml on the central portion of the lid cheek deformity. Notice how I position my smart hand over the orbital rim to avoid inadvertent injury of the globe. I would now inject on the lateral segment of the lid cheek deformity the remaining 0.1 to 0.2 of the product, bringing a total to 0.5 ml for each eye. With the needle technique, I begin my injection in the inferolateral portion of the tear trough, and using a 30 to 45 degree approach, I would go deep into the supraperiosteal plane, heading towards the superomedial segment of the tear trough. I always reflux to check for vessel puncture. Then I would slowly inject small aliquots, depositing hyaluronic acid below the orbicularis oculi muscle as I withdraw. This is the best approach to avoid Tyndall effect. I always use my best judgment in approximating the amount injected through direct visualization. The amount that I inject in the middle tear trough deformity varies from 0.2 to 0.3 ml. Then, I proceed to perform my second puncture, filling the middle hollowing of the tear trough deformity. I usually inject anywhere between 0.1 to 0.2 ml of Restylane. My personal preference for the tear trough deformity is still the use of cannula. The blunt tips usually provide a safer treatment as it reduces extravasation of blood due to vessel injury, making them less prone to bruising. I then gently massage to even out the distribution of the hyaluronic acid. I do remind my patients not to put pressure over the treated areas. Let me present to you the before and after pictures. These are the front view of the pictures of the first case using cannula. Notice the improvement of her tear trough deformities. Right side views, I use a total of 1 ml of Restylane Classic. The second case, with the front view of the patient using the needle technique. These are quarter views with the needle technique. Another patient's using the cannula technique. This is her quarter view. And finally, the front view, again with a cannula and looking up. Stephanie, it's your turn to share your tips and tricks.
Sure. My first case is Rima. She is a 38-year-old Indian patient living in Hong Kong. This is her frontal view. You can see that she has a slightly hollow temple together with a slight eye bag appearance together with tear trough and a relatively bottom heavy face. View. You can see that while her brow shape is pretty good, she does have some temporal hollowness, which gives the side part of her upper face a little shadowy appearance. So that's why in her case, I've chosen to inject in the subcutaneous plane over a bigger region with Restylane volume. Here are my markings. Just like you, Bong, I first start by marking the temple crest and then the posterior aspect of the orbital rim, followed by the superior aspect of the zygomatic arch. And in addition, I would mark the area of hollow when I'm injecting with a cannula. This is how I do it. Taking my cannula connected to Restylane volume, I then just go to the subcutaneous plane where I inject the product in a retrograde fashion slowly through small lines over the temporal region. Now, don't be alarmed that initially you will be able to see threads of filler underneath the skin. But the reason why we use Restylane volume in this area is exactly because it is a very forgiving product that will improve with massaging. And even if there's still slight unevenness after your massaging, over a few days as the product absorbs water, it will even itself out. So there's no need to worry. And make sure you also tell the patients that when we're injecting in the subcutaneous plane, initially the superficial veins can become more engorged, but this is only a temporary issue and will settle down over about a week or so. Coming back to Rima, here is her full face view after a full face treatment. Now, if we just focus and look at the upper face, you can see with the treatment of Restylane volume over the temple, together with my product of Restylane over the tear trough, it has really improved her tired looking eyes. In particular, notice in the temple, with the subcutaneous injection of Restylane volume in the temple, it did not change her already pretty good eyebrow shape, but instead even out the lighting over the upper part of her face so that it looks better and more in harmony with the rest of her face. Let's go to our second patient. This is Rita, a 40-year-old patient living in Hong Kong. Now, Rita has quite a narrow and short face. In particular, she needs a little bit of blending between her temple crest and the temporal region. And that's why in her case, I've chosen to inject with Restylane Lift. Again, Restylane Lift is the product with the highest G prime within the Galderma portfolio of hyaluronic acid filler. Whenever we use Restylane Lift injecting into the temple in the deep layer, it can really help to bring the patient's lateral eyebrows up. However, since Nasha product is a little bit more prone to swelling, we will need to tell patients to be expecting a little bit of a slight pressure sensation over the temples for 2 to 3 days after the treatment. The treatment of when I inject this with a lift is exactly the way I would do it with volume. My injection point is 1 centimeter behind the temple crest and 1 centimeter above the lateral eyebrow. Remember to aspirate before you inject, but keep in mind also that a negative aspiration doesn't necessarily mean that you're not in the blood vessel. Always pay attention to whether there's surrounding blanching and whether your patient is experiencing pain on injection. Again, the product of choice here is a Restylane Lift using the needle that came in the box, and in Rita's case, I injected 0.3 per side. Here is her immediate before and after result, and you can see that if we zoom in over the eye region, you can see how that injection has really helped to improve her sad looking eyebrows with the lateral brows a little bit lower than the medial brows, to after the treatment where her eyebrow shape is much better. And of course, the transition from the temple to the forehead is much better as well. Now let's talk about treatment of the glabella, which is another important thing that patients will come to us for when they're trying to get their face to look better, especially with the area around the eyes. One of the most common concerns that patients will have is how often will they need to come back to maintain the results. Here, allow me to share with you the results of the DREAM study. DREAM actually stands for Dysport Real World Evaluation and Measured Satisfaction Study, which is a clinical study conducted to evaluate the subject evaluation of twice yearly treatment of Dysport. This is a multi-center, multi-country studies where patients were studied over 2 years, where they were asked to come in twice a year, 6 months apart. In total, we had 120 patients in the study, and some of them were treatment naive, some of them were treated with other products before. The primary result of this study was highly satisfied patients. In fact, 95% of subjects were satisfied with the results at 2 treatments a year at 50 unit dose per treatment. The other things we have found with this study is that while most patients see results within 2 to 3 days, 1/3 of patients saw results within 24 hours, and the median time of onset was 2 days. From the study, 98% of patients would like to receive the same treatment again, while 97% of patients would recommend this treatment to their family or friends. Word of mouth, that's where the most effective referral source will come in, that will most benefit your practice. So the summary of this study is that some patients see the results within 24 hours, but most will see it within 2 to 3 days, and majority of patients find that the results will last for 5 months or more. Of course, we cannot talk about the look without mentioning about the glabella. First, let's review the anatomy of the region. In here, we have the corrugator supercilii muscle, which is situated from the frontal bone medial to the eyebrow, from where it extends laterally and superficially. The corrugator produces the vertical lines between the eyebrows, which most patients call the number 11s. It is important that we keep in mind that the corrugator is a muscle that changes in depth throughout its course. Medially, it is deep, and laterally, it is more superficial. Let's look at some anatomical slides. Here you can see when we flip over the skin, we see the subcutaneous fat and the frontalis muscle. And if we flip that down, we see the frontal bone, the periosteum, and then the corrugator at the corner. If we zoom this in, you can really see how right above the bone is the corrugator supercilii muscle. And around that area, we also have the angular artery as well, which is why the glabella is one of the most high-risk areas of injecting filler. Now, next in this area, we also have the procerus muscle, which draws the medial eyebrow down. Its origin is in the fascia over the nasal bone, and the insertion is in the skin between the eyebrows, merging with the frontalis. The procerus is a thin muscle that's only 1 mm thick, and average it's 2 to 3 millimeter below the skin. Here is Rita again, that I showed you earlier on with the temple injection. Here is Rita frowning. You can see that she has a moderate strength frown that makes her look quite unhappy. So when treating this area, just like using filler, I always start with marking. Mark the point where you plan to inject based on the wrinkle pattern as well as where you see the bulk of muscle. The standard injection points here are 5 points of 10 Spaywood units of Dysport, which you will see me doing here. Of course, remember to clean the skin before you inject. Now, what I usually like to do is keep my thumb right below the eyebrow to minimize the chance of any product going into the levator muscle. Again, medially, the injection should be deep, and laterally, the injection should be more superficial, following the anatomy of the corrugator muscle. Whereas over the procerus, the injection should be deep, right on top of the bone. Here again is Rita, before and after her injection when she's trying to frown. You can see that with that injection of 50 units of Dysport over the glabella, she's no longer able to frown. In addition, her eyebrows are a little bit lifted, giving her a happier look. Now, nowadays, a lot of patients are coming in to get Dysport for preventative nature. This is a patient that I first started seeing in 2015 when he was only 35. And you can see that back then he has quite a strong frown. Compared to now, when he is 41, you can see that even though it's been 6 months since his last injection, his frown is nowhere near as strong as where it should be. And you can see also here that he used to have a prominent wrinkle in the glabella, and with twice a year treatment of 50 units of Dysport over the glabella, that line eventually got better.
Thank you, Stephanie, for sharing. It was a pleasure for me to be here with all of you today to share some of my personal experience in treating the periorbital region.
Same here. I hope our presentations have given you some insights to help your patients make a great first impressions. Now, let me introduce you to our next two speakers, Dr. Phan Wen Seng from Taiwan and Dr. Putipong Pongsuwan from Thailand. They will talk to us about the next first impression, the smile, perioral rejuvenation. Phan Wen and Putipong, the stage is yours.
Thank you, Stephanie. Hello, everyone. I'm Phan Wen Zeng. I'm a dermatologist from Taiwan.
And I'm Putipong Pongsuwan from Thailand. It's a great pleasure for Phan Wen, and I would like to share some of our experience in treating perioral region with all of you today.
A first impression is the immediate evaluation people make after seeing others. A friendly smile has a significant first impression impact on others.
When you see a friendly person projecting a relaxed behavior with a lovely smile, you are more likely to assume that this person is reliable and authentic. Flashing a big smile displays confidence, friendliness, warmth, and other positive feelings.
Since smiling is so powerful, let me start with showing you how I assess the lips and surrounding areas. So let's start with the assessment of the lips. The assessment of the lips begins with understanding the difference between more aged lips and a younger looking lip. In more aged lips, the volume looks to be decreased, or more precisely, its vermilion height decreases. And also, the definition of the vermilion border gets blurry. Both of the above were due to the loss of eversion in the lips. And when the lips inverts inward, not only the red lip show decreases, but also the philtrum looks longer. And also, we see loss in the anterior projection in the lips. That's partly due to the loss of deeper bone support and denture support. And also you can see with age, the mouth corner drops down. The mucosa quality also worsens with loss of light reflectance, with roughness, and with increase in the wrinkles. But fortunately, most of these signs of aging in the lips can be reversed with HA fillers. So to help you with lip assessment without leaving anything behind, this is the perioral assessment scale. It covers the shape of the lip, the proportion of the lip, and dynamic features, symmetry, and also the quality of the skin. So let's practice with this patient. This is a 40-year-old beautiful lady, but her lips were too small compared with the length of her face and other features of her face. So the volume, the contour of her lips were not enough, and also the proportion between the upper to lower lip is ideally 1 to 1.6. The proportion of the upper cutaneous lip to the entire chin is ideally 1 to 2. And she had some minor asymmetry in her lower lip, no problem in her skin quality. So from this scale, we can see what she needed the most is to increase the volume and contour in her lips, and also to correct the proportion between the upper cutaneous lip to the entire chin. So I used the lift to elongate her chin to bring this proportion to the ideal 1 to 2, and also I used rest and kiss to increase the volume, increase the curvature in her lips, and she did look more beautiful with a fuller and more contoured lip. Another patient with different need in her lips. As you can see that her lips were much wider compared with the previous patient. She had a beautiful upper lip, but the lower lip was too thin. So she had an inverted proportion between her upper to lower lip, and also her lower lip was flat without curvature. So from this scale we can see what she needed the most was to increase the volume and the curvature in her lower lip. So we can correct the proportion between her upper to lower lip. And also I created this very prominent contour to her lips. I created very clear two tubercles in the lower lip, and also I emphasized the cupid's bow in her upper lip. And this is what our Asian lady patients prefer nowadays. They call this candy lips. I guess it's because it looks sweet and makes people want to taste it. So this need to emphasize the contour more than volumization is because many of our patients are born with wider and fuller lips. So if we volumize more, you would end up with fat sausages in the lips instead of creating beautiful lips. Like this lady, many of our Asian patients are born with relatively good volume in their lips, so they are not very deficient in volume. So if we volumize generalizedly in the lip, we would end up with unnatural fat sausages. But again, this lip is not perfect either. So how to make it even better? That is when we emphasize the contour. We would increase the curvature in the lower lip. We would increase the definition in the cupid's bow, and that would make the lip more attractive. Another patient, she looked unhappy, and she heard that you can use HA fillers to create those smiling lips, which is a common request nowadays. But the main reason why she looked unhappy was not in her lips. Yes, her lips were thin, were flat, were asymmetric, but what really made her look unhappy was because of those depressions, those concavities around her mouth. So these concavities reduced the support to her lips, and in addition, she had this mentality straining. All this combined lead to this unhappy look in her lips. So in addition to shaping her lip with resin kiss, during assessment, we should also assess the perioral region. We should also treat these depressions accordingly. That's how we can have a more holistic improvement in the entire perioral region. Thank you.
Thank Fang Wen for taking us through your method of assessment. The perioral assessment scale is very systematic and easy to follow. A very useful tool.
No problem. Before we jump into the injection, maybe you can give the audience a quick review on anatomy.
I would love to. Before we get going into the anatomy in detail, let's have a quick review on the terminology of lips and surrounding. This is philtrum, philtral column, the cupid bow, white row, or in another word, vermilion border, wet vermilion, dry vermilion, and a depressed area under the lower lip is mentolabial fold. What are the ideal features of the lips? First, the distance between the oral commissure should be equal to the medial limbus, and the upper and two lower lip ratio is about 1 to 1.6. The upper lip has a small bulge at each commissure and a central tubercle. On the lower lip, there are two bulges medially with a slight depress in the middle, and also on the lower lips, there are two depressed laterally. On the profile view, the upper lip should project 1 or 2 millimeters forward from the lower lips. And when we draw a nasomental line or the ricket line, the upper lip and the lower lip should be at or slightly behind this line. Also on the profile view, this is an average mentolabial fold depth. In this slide, all these pictures show the same sagittal chin projection. Please keep in mind that the mentolabial fold depth may impact on the appearance of lip projection, particularly lower lip. Regarding vascular supply, the superior labial artery and inferior labial artery are the main arterial supply of the upper and the lower lips consecutively. Let's have a look at the sagittal view of the lips. From the study, the majority of the superior and inferior labial artery found at submucosal plane, while about a third found at intramuscular and only about 5% found at subcutaneous layer. And we may apply this knowledge to our injection technique. So usually, when I want my injection to be precise, I use a sharp needle because I want to get a better contour or a better definition of lips and to lift the corner of the mouth. And here are some tips for safety approach. First of all, you have to inject superficially, subdermal or subcutaneous plane. Perpendicular approach like this. And do not go beyond the wet-dry limit, because if you go beyond this limit, that means you close to the artery and you going into the submucosal plane. avoid the submucosal and the intramuscular injection. And this is subdermal superficial injection, the vermilion body injection, and the dry vermilion injection. That's all for me.
Thanks, Putipong. Rejuvenation of the perioral region can be very challenging because of the many factors that affect the appearance of this area.
Yes, there are other environmental and lifestyle issues that must be addressed, such as smoking, sun damage, and poor dental health. When it comes to perioral treatment, Phang Wen, can you share with our colleague how you choose the most suitable product to treat the different indications?
To choose the product for lips and the perioral regions, Nasha has higher G prime, is the firmer product. OPT is somewhat moderate in G prime, but it is more flexible. Nowadays, mostly we combine these two technologies to treat a patient for the best result. Let me share with you the story of this patient. This is a 58-year-old lady. She was thin in the lips without curvature, without definition, and she was atrophic in the perioral region with sagginess. The first time I saw this patient, we didn't have OPT in Taiwan yet, so we used Nasha. And I used lift to her piriform fossa, to her chin apex, and to the pretrosulcus. All of this were deep injection to the bone. But to the soft tissue, in the nasolabial fold, in her lips, and to the labiomental sulcus, I would need something with smaller particle sizes, so I used Restylane Classic. And after injection, we had a good improvement. She looked younger, she looked much healthier with increased support around her mouth and more volume to her lip. And time flies by. A year later, this is the next time I saw this patient. This time we have OPT. So I still used lift to inject her piriform fossa and around her chin, but this time I used Define to her labiomental sulcus. I chose Refine to inject her nasolabial fold, and I used Kiss to her lips. So OPT for soft tissue in this second treatment. I didn't tell her that this time I used a different product, but I asked her, between these two injection treatments, which one do you like more? And she said that she preferred this second treatment in which I combined Nasha and OPT. Why? Because she said she experienced virtually no downtime. There was minimal swelling and no rigidity. She felt it to be natural the next day after injection. What she said was not only true, but also had been proved in clinical studies that after OPT injected, we had minimal recovery time. The facial expressions are natural after OPT had been injected in the perioral region. And in this interesting study, even the patient's partners agree that the lips are natural and they want to kiss their partners more. So why is OPT natural? Not only because that is softer, but also because it is more flexible. The definition of flexibility is the extent of deformation a material can stand before yielding. To put it more simply, it means when you stretch a gel, how difficult it is to break the gel apart. So now I'm expressing a bolus of product on the table, which is low in flexibility. And this is another product with high flexibility, which I also expressed a bolus of similar quantity. And from this, how reluctant it was to lift the syringe, you know that these two products are very different in characteristics. So now let's imagine when these two products were injected under patient's skin, get compressed, get stretched with muscle movement, skin movement, and you can see a certain degree of deformation. the product with lower flexibility breaks apart, while the other product to your left with higher flexibility, it is more able to maintain its original shape in its original position. So that is the benefit of using a more flexible product in more mobile regions. So she can kiss and she can smile with natural facial expressions, and it is more likely that we can maintain a smooth and stable result. That is the benefit of using the flexible OPT gels in the perioral region. This is a 58-year-old patient. She had a saggy and heavy lower face. You can see the depression around her mouth. You can see the static wrinkles. And also, when she makes facial expressions, you see exaggerated wrinkles. To her lips, we are going to increase the contour without over volumizing her lips. And in the upper lip, I would inject from the vermilion border. And if I want to do volumization, I would do a fanning injection. But if I don't want to volumize, if I only want some definition in the vermilion border and some contouring, then you can skip the vermilion body and only inject the vermilion border. So I would use a 30 gauge needle with KISS. I would align my needle almost parallel to the skin and enter the needle from the cutaneous skin and inject superficially in the immediate subdermal layer in a linear threading technique. And you can also use similar technique to emphasize the cupid's bow and to the filter ridges. And in the lower lip, let me share with you an easy technique. First, we draw two vertical lines that transect the mouth corner and the filter ridge, and then two more lines that would divide the lower lip into equally distanced parts, and these reference lines give you easy reference where to put your bolus injections. So if I want to volumize the entire lower lip, you inject those boluses, more product medially, less product laterally. But if you don't want a generalized volumization, if you only want to create some curvature, then you skip those other points and inject only to the tubercles. So I would again use either 27 or 30 gauge sharp needle. I would enter the needle from the skin, not from the red mucosa. And you can see my needle was superficial. I would not go deep. I would not go beyond the muscle. I would stay away from the wet-dry border because that's where you get higher risk of hitting the blood vessels. And you can use a similar technique in the upper lip if you want to create a tubercle in the upper lip for more curvature. And also, I would add tiny boluses to the mouth corner, below the mouth corner, to increase the support and encourage the lifting of the mouth corner. And to the chin apex, I use the lift, and it is a needle injection deep under periosteum in boluses. And to the labial mental sulcus and to the marinate lines, I would recommend OPT because this is a mobile region. And now I'm using Define with a 25 gauge cannula. The dangers here include the inferior labial artery, the labial mental artery, and also the mental artery. So you are really dancing with dangers here, and that is why I prefer blunt cannula when I inject this region. And these blood vessels starts in layer 4, although when they approach more medially, they go somewhat more superficially. So even if you are using a blunt cannula, still go easy, be gentle with the injection with low pressures. So after injection, we improved her definition, her curvature in the lips with KISS without over volumizing the lips. We reduced the heaviness in her lower face by the support from left along her mandible, and we used Define to reduce the sagginess and depressions around her mouth. And in dynamic evaluation, when she kisses, when she smiles, you see natural facial expression, you don't see the lump of products. So this is what we call maintained naturalness of facial expression. And what is even better is that when she stretches her skin so much, you can see those exaggerated wrinkles around her mouth improved after injection. This is what we call a positively affected facial expression. And that is because we provided this region, which was atrophic in skin, which was deficient in volume support, with a flexible gel, which is OBT. So this is how I would give the patient an overall holistic and harmonized result in the perioral region. Thank you. So Rest and Kiss is my favorite product for lips. But Putipong, I know that Kiss is not yet available in Thailand. So the audience and I are eager to see your injection technique with your product of choice.
Sure, I will show you my technique with my product of choice. The easiest way to choose the right product for our patient is using a useful tool, the perioral assessment scale. We evaluate lips for contour, volume, and projection, and also the surrounding area that are related to lips. The first example case is 42 years old Thai woman. Her lips become thinner and surrounding area show some degree of volume loss, particularly malleolate area. This is a common problem usually seen in Thai women at this age group, around 40 or above. Patients in this age group want more natural outcome for their lips and be proportionate with other areas of their faces. They don't like completely full lips as European style. So I apply the perioral assessment scale to identify her problem. Her main problem that we found are disproportion lips and lower face, disproportion upper and lower lips, contour, volume, and projection. And this is before and 1 month after with a very natural outcome. And on the profile view. The summary of product used in this case, I use Resilient, a Nasha product for a better contour and better definitions of lips. For the malleolate areas, we need more flexibility of the product. So OBT is a product of choice. And I choose Resilient Define 0.5 ml each side subcutaneous layer. And to support deep structure like chin and mandibular border, I choose Resilient Lift, a Nasha product with targeted product integration property. 0.3 ml at the chin and 0.35 ml mandibular ligament area each side. The injection case 1 is 45 years old Thai woman who want to improve her look and afraid of unnatural outcome. Her desire is similar to the previous case, as we expected from patients in this age group. Use the perioral assessment scale to identify her problem. The main problem, contour, a little bit on the volume and projection. I usually start to inject at the upper lips to create a small bulge laterally, both sides, and then enhance the vermilion border. I like to use 2 fingers to control and create lip shape like this. When injection here, you have to go superficially and slowly inject with a linear retrograde technique. You can feel the product between your finger. And this is the way to enhance the cupid bow. And on the other side. And sometimes I inject the dry vermilion like this. On the lower lip, I support the corner of the mouth, just 1 small drop. I don't want to create a bulge here, because here it should be a slight depressed. As you can see, a little small drop. And then move to the vermilion border. Same technique, superficially, and create medial bulge with subcutaneous injections. Do not go beyond the wet-dry limit. Otherwise, that means you go too deep. You can see I go superficially. For the malleolate area, I use 25G cannula to inject with retrograde fanning technique, subcutaneous layer. This will create balance and improve lifting for the corner of the mouth. Again, in this case, before and after. In this case, I use Vaseline to create definition of the lip. 0.35 mm on the upper lips and 0.65 mm on the lower lip. And Vaseline define at the malleolate area 0.5 mm each side. The example case 2 is 32 years old Thai woman. This is an example of patient in younger generation. Patients in this age group are different from the previous one. They want to improve the appearance with more prominent and more attractive lips. Again, I use the perioral assessment scale to identify the problem. The main problem that we found and we should focus for her are disproportion, upper and the lower lips, contour, volume and projection. And this is before and 1 month after. Oblique view and the profile view. The product used in this case, Vaseline, Nasha product for lip definition, 0.25 mm on the upper lips and 0.75 mm on the lower lip. You may notice that I focus more on the lower lip. And Vaseline define OBT with more flexible gel property in a movable area like a marionette area. 0.5 mm subcutaneous layer each side. The last case is 28 years old Thai woman who want to look more attractive and correct unhappy appearance. Her beauty preference is similar to the previous one. A younger generation wants something more noticeable for their beauty. This is her main problem that we found from the perioral assessment scale. This proportion lips and lower face, this proportion the upper and lower lip, contour and projection. I use the same approach as the previous case. Start to inject at the upper lips to create a small lateral bulge with superficial injection, and then inject vermilion border to create better contour. Use 2 fingers to control the product. And to keep it bold. As I mentioned before, I want to support lower lip corner. That will improve lifting for the corner of the mouth. Then I inject a very little here, just a small drop. You can see just a little here, only a small drop to lift up corner of the mouth. Then I inject vermilion border superficially to the vermilion border, superficially, and use 2 fingers to control the product. See, I go superficially and inject slowly, retrograde, and dry vermilion of the lower lips to create a small medial bulge here. In this case, I elongate her chin to improve the proportion of the lips and the lower face. For safety, this is a good idea to aspirate until you see the bubble before injection, just like this. Here I inject deep to the bone to support under the mandibular ligament. Then move to the malleolate area. As you can see, I use the cannula as a dissection tool to release adhesion before injection with a retrograde fanning technique. And last, to create a small tubercle here, very little here. That's all. Before and after. Before and after. And this is the profile view. The product used in this case, again, Resilient, a NASA product for definition of the lips. 0.2 mil on the upper lips and 0.8 mil on the lower lip. As you can see, I focus more on the lower lips, and actually we could add a little bit more on the lower lip in this case, but with limited budget, I think this is suitable for her in this session. And again, I should identify an OBT more flexible product in movable parts like marionette area, 0.5 mil each, and resilient lift to support deep structure, chin, mandibular border under the mandibular ligament. In summary, regarding lips injection, I consider on the desire of patient in each age group. Younger generation want more prominent and attractive lips, while middle-aged generation want more natural and be proportionate with other area of their faces. The surrounding area of the lip are also important because aging happens everywhere. Then Then lips and surrounding area should be treated together to get the balance and harmony of the perfect smile. This brings an end to our session today. I hope myself and Fang Wen were able to bring you some new perceptions in peri-oral rejuvenation.
Smiling makes us feel positive and happy, which can be contagious. An attractive smile has the greatest impact on a positive first impression, so why not smile more?
Smile not only affect the first impression, smiles can make a lasting impression. So keep smiling. Stephanie, back to you.
Thank you, Putipong and Fang Wen, for sharing your experience. This brings an end to our webinar. I hope you have enjoyed the look and the smile today. Tomorrow, we will continue with the remaining first impressions, which are the profile and the glow. Don't forget to complete the survey and download your certificate. See you tomorrow at the same time.